In just 4 years, the incoming freshman class at Quinnipiac's newly opened medical school will walk across stage to receive their diplomas. However, this class will be different. They will be required to know the ins and outs of the Affordable Care Act.
The primary mission of the Frank Netter School of Medicine is to train medical students who will practice medicine, hopefully in primary care settings. It has a lot of provisions to enhance the delivery of primary care services to patients.
Students who entered the school this past year will graduate from the medical school with the Act fully in effect. This will be the first class of working medical professionals that need to be educated on this new act that will have a significant impact on the way patients get treatment.
The whole Affordable Care Act is about team medicine, and so we're trying to emphasize to our students the importance of teamwork in medicine.
According to the dean, patients are going to their specialty doctor right away, instead of seeing a primary physician, nurse practitioner, or physician assistant first, who can properly diagnose them without the high cost.
So for example, you could have a medical student see a patient who is complaining of lower back pain. That medical student might say, I think you need to see a physical therapist. A physical therapy student could then see that same patient, and so it's a way for the medical student to appreciate the value and skill that the physical therapist brings to the care of the patient, and vice versa.
One of the main goals of the Quinnipiac University Medical School is to graduate more primary care physicians, which is one of the same goals as the Affordable Care Act.
The model was we're training the captain of the ship who's going to bark out orders to the members of the crew. I think the current model is more the NASCAR pit crew, where you have a group of highly skilled individuals, each with very specific expertise, all coming together to take care of the car, but just substitute the patient for the car.
Over the years, medical students nationwide have opted to enter into higher paying specialties, which has created a shortage of primary care doctors.
But the patients have to recognize it as if they're not seeing the physician, they're not getting substandard care.
Although a lot of questions remain about how the Affordable Care Act will affect patient care, it is imperative that the students recognize just how much it'll help the field.
So it's to build the workforce that this country desperately needs.